The International Patient Lounge of Medanta Medicity at Gurgaon in India. This, as you can see, it's a fairly busy place with a large number of patients coming from all over the world to get treatment from some of the finest doctors in India who have all gathered on one platform at Medanta Medicity. Patients coming from all over the world not only get the best treatment but they also get the best cost, because treatment in India is fairly cheap as compared to the other options available all over the world. We can tell you that this is one of the best team of doctors across all specialties. The hospital, created by renowned cardiothoracic surgeon Dr. Naresh Trehan, has 1650 beds. It is located about 20 kilometers, which takes about 20 minutes from the international airport at New Delhi. The patients have a very comfortable stay in this hospital because the staff is highly trained, the doctors are absolutely great, and the hospital deploys the best technology that is available anywhere. Mark Wiseman, who came to India all the way from Sacramento, California, in the United States of America to get his knee replacement surgery done from Dr. Ashok Rajgopal, is being prepared for taking the sutures off just 14 days after the surgery as the nurse works on him, and Dr. Ashok Rajgopal is just about going to see him.
Hello and good morning. This is Kuldeep Chaudhary from Health in India. I'm in the chamber of one of the most renowned knee replacement surgeons all over the world, Dr. Ashok Rajgopal, who happens to be the chairman of the Bone and Joint Institute at Medanta Medicity, Gurgaon. Dr. Rajgopal, who probably heads the biggest knee replacement program anywhere in the world, where more than 100 patients every month get their knees replaced. We are here to record the statement of Mr. Mark Wiseman, who's traveled all the way from Sacramento, California, USA to India to get his knee replaced. Dr. Ashok Rajgopal, we are here on the 16th of May. Mark got discharged from the hospital on the 2nd of May 2012, and today we are here to get the stitches removed. Mark did a lot of research on where and with whom to get his knee replaced. So he found out that Zimmer probably produces one of the best knee replacement and has got a protocol in place wherein they provide the patient specific instrumentation. I'm joined by Dr. Rajgopal. Let me begin by asking him what exactly is the Zimmer protocol. Good afternoon, sir.
Good afternoon.
Sir, may I ask you what exactly is the Zimmer protocol?
The Zimmer protocol basically embraces a technology where a patient is subjected to an MRI of the hip, knee and ankle. A morphed image of the MRI scan is then circulated and sent to us for validation. This is actually some sort of a virtual surgery, because on the basis of the templates that are provided, on the strength of the images that are captured by the MRI scans, we get a very accurate index of what the deformity is, what amount of correction needs to be done, and we get a template on which the company from Belgium actually fabricates a sizing option. The option that they give us is something that we can change depending on what we feel, and it gives us the freedom or the flexibility, if you like, to actually do the patient's surgery well before it's actually done. So it's really like a virtual surgery. Once this exercise has been done, we validate this configuration, send it back to the company, and approximately between 15 and 20 days later, we get a mold. It's a type of a protocol, it's a type of a block, which is actually the image of the patient's knee. Now these are cutting blocks which help us to accurately use in terms of restoring the alignment. Most patients undergoing knee replacements have the alignment of their knees in relation to the hip and ankles out of place, and using these validation blocks we can actually realign the procedure. Put very simply, what it does is it takes away the human element out of the technicalities of the surgery, so it makes this a far more predictable and a reproducible option. So we use this quite a lot, and we had this option with Mark, I'm glad to say it worked out well, and he's undergone the surgery. He's done very well. We're extremely pleased with his progress. He's flexing his knees about 2 weeks from his index surgery. He's just had his sutures taken out today. His wound's looking good. He's already flexing to about 115, 120 degrees, which is remarkable. And I suppose some part of it obviously goes towards the effort that Mark has. He came in focused, he wanted to get better, so he's had all of that stuff. And obviously having this technology play its part, and we use the high-end flex implants which give a enhanced range of movements. We expect that his knees should flex to about 135 to 140 degrees. And I expect that movement to be achieved in the next about 2 to 3 weeks.
That's wonderful. Mark has been reporting that he's feeling better day by day, even though he's been doing a lot of physiotherapy very regularly. And he's also told us he's paid about only $800 for all this, the protocol, which I believe is not a very big amount for the Indian patients also. And I think it saves a lot of operating room time also. Because we've seen lots of other hospitals typically take 3 hours, 4 hours for doing a knee replacement surgery. So they are probably trying to do what you do beforehand. They try to do in the operating room, just trying to fix the knee, based on the patient. So this allows you not only to achieve better results, but also do more patients.
Yeah, I guess so. Obviously, whenever you operate, you want to optimize on your time management. It is a surgery which involves a large foreign material to be implanted into the human system. Clearly, the less time that the knee or the wound remains open, the better it is from the patient's perspective. But for us, the main advantage of using these technologies is to achieve a predictable and reproducible outcome.
I'm pretty happy to be with you, Dr. Rajgopal. As I love to say, you are a phenomenon. You've put India on the world map with the latest advances and the kind of work that you're doing. Truly, you're a Bharat Ratna material when it comes to the healthcare. You're absolutely the king in the field of knee replacement. It's a pleasure meeting you. I would now let Mark take the seat and would let you examine Mark. Mark, please come.
Hi Mark, good afternoon.
Good afternoon, Doctor.
It's great to see you, the way you're moving around in the bed, in the chair, walking. How are you feeling?
I feel wonderful. I feel like I want to go out and do some dancing. Absolutely, it's going faster than I thought it would.
Yeah, that's awesome. Can you straighten out your leg and just...
Oh yeah, absolutely.
That's wonderful. Can you bend the knee for me?
Yeah.
Well, as I said just a few moments ago, Mark, I think this is just the beginning. Your ranges are going to improve substantially. I think you're about 60% of the way. I expect movements to continue to improve for up to about 4 to 6 months. And I'd like to hope that in the next 6 weeks or so, you should be able to do pretty much everything that you have been looking forward to.
I was advised that because I'm tall, the hamstrings tighten up a little bit, so I'm going to work on the hamstrings a little bit more and try to keep them loose, loosened up so I get that full range of motion.
Sure.
So,
Great. That's wonderful.
yeah, I'm so happy to come here. I was fortunate to get a hold of Zimmer, and it took about 2 weeks, but I did get your name, and I'm really very appreciative of the doctor and the hospital. The care here is just absolutely wonderful. I'm going to try and spread the word to my fellow Americans and my American friends to, fly a little further and get the job done right. So
that's very kind of you to say that, Mark. So I'll end by saying it's been a pleasure looking after you, and I hope you enjoy the rest of your stay in India and have a very, very safe flight back home.
yeah, I'm going to hang around a little bit and try to see some of the sites.
Absolutely, you should do
Taj Mahal and
that.
maybe go over to Goa beaches.